Plastic Surgery in Miami. This is our weekly check-in. We go over different topics in plastic surgery and I get to answer your questions. And today we're going to be talking about ultrasound. Why? Because it is very popular to talk about in BBLs, but there's a lot of things that we can do with an ultrasound in plastic surgery that not everybody knows. So I wanted to touch base on that. And also talk a little bit about a couple of misunderstandings with ultrasound that people sometimes have. So we'll clear everything around ultrasound and then we'll jump into your questions, okay? So let's start with the first misconception. Ultrasound imaging is not the same as ultrasound energy. We discuss a lot about VASER and that it's ultrasound, and then you see there's some BBLs that have VASERs, others not, and then people are like, so you're doing ultrasound in some, and then you're not doing ultrasound in others? No, we're doing ultrasound imaging in 100% of the BBLs we do, but we're not doing ultrasound energy, which is VASER, in every single BBL, okay? And let's talk a little bit about that. Ultrasound imaging is an imaging device that we use for many things, but the most common one that we use in, or majority of women that have had kids know is because we see our babies when they're in our belly with the ultrasound. So that tells you how safe is this imaging device. We have different imaging technologies in medicine, including CT scan, MRI. All of those have radiation that passes through our skin in order to get an image. That is not true with ultrasound, and it's one of the benefits with ultrasound energy. It does not transmit radiation, and that's why it's safe to see babies with it. So it is one of the advantages of it. The other big advantage of it is the easily availability of the device, you know? And it's, of course, not everybody has it because you have to purchase it, but it is a device that is not as expensive as a CT scan MRI machine. It is more affordable, and majority of plastic surgery offices or ERs can have a handheld ultrasound device like this one. It is very easy to hold, ergonomic to your hand. It is very light, so you can use it in different scenarios and have it hand available as and a lot of ER doctors are calling it this exam, you know. And why? Because we can see a lot more than just by palpating and touching and examining you, and without the need for radiation, any of that. So it is evolving medicine, not only plastic surgery, and you probably, if you've gone to an ER recently, you've seen that the ER physicians are using it a lot, not only as a order for a radiologist to do it, but as a physician, us using it in our day work to enhance our physical examination findings. And I'll talk a little bit about how we can use it, and I use it every day in plastic surgery, but this as general medicine has been revolutionary in every other field. For example, orthopedic surgeons are using it to inject in the joints. Physical therapists, PMNRs are using it to put nerve blocks, and so on and so forth. So it is something that I think it's beneficial to almost all specialties, and I use it, again, almost every day in my practice. So it is very different than energy. Ultrasound energy is like VASER. It is the ultrasound waves, but it's transmitted at a higher frequency, so it creates a thermal energy or heat, right? And that's how the VASER creates that energy that breaks the fat and also coagulates and increases collagen information and all the good things about VASER. But it's not the same as ultrasound imaging, okay, which is what we use for BBLs. And let's talk about the first point here. It is great to see, these are basically the areas that I use it every day, so I'll go into different ones, right? I use it to identify anatomy, right? When we put this in the area that we want to evaluate, this and depends on the probe, right? This is the probe that I have, that it's a generalized body one. There's a facial one that's a little bit smaller, but this one works in the majority of times for what's called soft tissue. So this allows me to see skin, muscle, subcutaneous tissue, up to a certain depth level. This is not good to see babies, and why do I know? Because I tried it when I was pregnant, and it's not, it's not deep enough. So the one used for babies, the probe is different, it's a little thicker, so you can see deeper because the baby is deeper in our bellies. But this is great for the ones that, for the purposes that I use it for, which is soft tissue, the areas surgically that I go. I don't go inside your belly, so I don't use it to see that, but I see it for muscles, skin, subcutaneous tissue, nerves, vessels. This has, when you put the ultrasound in, you can in the app. This connects to my iPad, my phone, and I can see the image in my iPad, so it's very convenient. And I just click what's called Doppler duplex energy, and it identifies flow. So I can identify arteries, vessels, arteries, veins. So it's great for the thicknesses, so the different planes, identifying vessels and where are the arteries and veins at, and also where are the nerves, okay? And this translates to the majority of things that I do when we're injecting, right? One is facial injections. You can use a facial probe and see exactly where are the vessels, so when you're injecting a filler, you don't inject it in a vessel. Avoiding injecting the filler in the vessel, which can cause vascular occlusion and then turn into skin necrosis or even blindness, and also trying to avoid more bruising. If we identify where the vessel is, we stay away from it, less bruising in your face. So it's great for facial injections, and for what I do here every day, BBL. So when we're injecting the fat, I use this probe. I'm making sure that my cannula is above the muscle in the subcutaneous space. And when I'm injecting the fat, I'm actually seeing the fat go in and inflate that space where I want the fat at. I am making sure that not a droplet of fat is going in your muscle, which that way you don't have the risk of fat embolism. One of those fat traveling to your lungs, and that's what it's very dangerous, okay? So every surgeon, I think every surgeon at all doing BBLs should be doing this. All of my BBLs are done with ultrasound imaging, but definitely in the state of Florida, it's actually illegal to do a BBL without the use of ultrasound. So this is something that if you're getting an ultrasound, if you're getting, a BBL, you should be asking your surgeon if they're using consistently an ultrasound. Okay, so that's for identifying anatomy, right? The other good one is for nerve blocks. I do tap blocks, which is for the tummy tucks. I inject Exparel, which is a numbing medication, in between your muscle layers, and this allows me to identify where my injection is to make sure that I'm injecting the medication in between the muscles that the nerves go through, and I am making sure that I am numbing the area adequately. We can also do a peg block, which is the nerve that goes and gives sensation to our breast region. So if you're having, for example, a breast augmentation and you want to do a peg block with Exparel, I can see with the ultrasound, inject exactly where the nerve is, and have a lot of control pain afterwards. So that's a very good alternative. If you're having, very, very rarely this happens, but sometimes you have chronic nerve pain after surgery because it can cause what's called a neuroma, which is scar tissue around one of the nerves. You can use the ultrasound, identify the neuroma, and inject steroid medication and lidocaine to treat that type of pain. So before the use of ultrasound was readily available, we were doing this just by anatomy, tapping, and just by palpating. But now that we can actually see it and inject it where we want it, the results and the relief is so much better. Okay. The other one that I incorporated in my practice and I think has been game changer is implant monitoring. So implants, especially silicone implants, should be monitored with ultrasound or MRI after you put them, right? Especially gummy bear implants. If they break, you're not gonna know because the gel itself, it's cohesive enough that means that it's not liquid, it's not fluid. It'll keep its shape. So FDA recommends getting an ultrasound or MRI 5 to 6 years later. It's 6 years later. So if you have your implants done now, 5 years from now, you should be getting ultrasounds every 2 to 3 years to check for rupture, okay? What was the hard part about this? And a lot of my patients experience this. One is that when you go to get a breast ultrasound, they're actually seeing your breast tissue. And the radiologist is not even commenting on the implant because the training that radiologists go through is mainly focused on your breast tissue, checking for masses, checking for areas that they need to biopsy, but not checking the implant itself. So what are they going to do? Suggest an MRI. Then we get into cost and radiation with the MRI to see the implant. Well, that's not needed anymore. I am trained in checking your implant. The important thing is here, and I recognize that as a plastic surgeon, this ultrasound that I do, I am not checking your breast tissue. So you still need to get your yearly mammogram ultrasound to monitor for breast cancer if you're over 40, okay? This does not translate to, okay, I'll go and I'll get both, but this will be specific for your implant, okay? I offer it for all my patients free of cost. But if you're not my patient and if you want me to check your implants, that's also a possibility. Just give us a call or fill in a form and just say that you want to come in for a consultation and breast implant imaging, and I'll do the implant monitoring and surveillance with the ultrasound. And what am I looking for? I'm looking for rupture. I can see rupture. I can see position and if the implant is flipped. And also if there's any fluid that we need to check and biopsy, okay? Not breast tissue, but all related to the implant, okay? So this is something that, again, I incorporated recently. I've seen a great take from my patients, and I think it's just something that it'll simplify and help all my patients that then don't know where to go for their ultrasound monitoring for the implants. Okay. And the last one is, and this I use it very frequently, is for my post-op course. So sometimes in the post-op period, you're like, is this swelling? Is this fluid? It's more swollen. It's more thick. Let's just ultrasound it. I go with the ultrasound, I check if there's fluid, I'll drain it. If it's just swelling, reassurance that there's an infection, we can check if there's an abscess to be related to that. So I think it's a great thing to add. I love having my ultrasound available instead of just relying on just palpating and touching, which of course, it's great, and I do too, but to have that extra help of the ultrasound helps kind of stratify or determine what things need to be drained, what things don't need to be drained, if the implant is okay. Sometimes I even had a patient that was early post-op that thought that the implant had flipped, so with the ultrasound we checked and it was in the correct position. We reassured her that everything was fine, it was just swelling, that you continue to massage and it will calm down. So I think it's a great addition. And the other thing that, before jumping into questions, that I get a lot of misconception is, if you're using the ultrasound for the BBL part of the fat transfer, why don't you use it for the liposuction portion of it? The reason is that with Exparel shot is that it is not approved by the FDA to use into tumescent solution. Exparel is bupivacaine that we've used for years, but it is manufactured in a way that it's engulfed in a liposomal little ball, let's say, microscopically, right, in the medication, that it starts to release over the next 72 hours. It hasn't been studied in tumescent fluid to put in liposuction large areas because we don't know how your body and the medication is going to react to the other fluids and medication and trauma from the liposuction, and there is a risk that those liposomal balls explode early on, and there's a risk of toxicity of the medication. So it's not advisable to use it in liposuction cases. Really, the liposuction portion of it, the liposuction pain is related to the liposuction portion of the procedure, and Exparel, it's not recommended, okay? I do it with surgical excisions. I include it in, for example, every tummy tuck that I do, and it is available to add it, for example, for brachioplasties, breast procedures, body lifts, but for liposuction cases, it is not recommended.
I need a tummy tuck after having loose skin. How can I do a consultation?
Very easy, okay? I'm gonna put it up here because it's a common question. So you go to our website, very easy, pureplasticsurgery.com. You go to there and you click virtual consultation form. You fill in that form and it will ask you a couple questions, ask you to send some pictures, and a coordinator will give you a call with my recommendations. And then at that time, you can ask her to book a virtual consultation, book for the surgery, book a virtual consultation, book an in-house consultation, depending on what you want to proceed with.
Okay. Do I have to get my epigastric hernia in my stomach fixed before lipo-BBL?
No, the epigastric hernia is actually on the inside, so I'm not going to be able to reach it with the liposuction because it's actually inside of your stomach. The epigastric hernia is basically, we have our diaphragm, which divides our lungs from our belly, and the esophagus passes from the chest towards the stomach through a little hole. And with a hernia, you have parts of your stomach kind of sticking over in that hole, and that's an epigastric hernia. So or hiatal hernia. If the hernia is outside of the abdomen, a ventral hernia, umbilical hernia, then we need to assess it before liposuction.
Why my below abdominal area is super hard from tummy tuck? It's so annoying.
So depends on how far in the post-op period you are. So with the tummy tuck, you're going to get a lot of inflammation in the lower abdomen area because it's gravity, right? All kind of goes there, and we have some ligaments in our inguinal area that are just going to hold that swelling in that area. It will go down, it takes time. Sometimes tummy tuck swelling can last up to a year, okay? It's not that you're gonna be swollen and at a year mark, you're not gonna be swollen. It's gonna continue to decrease over time. You may see some fluctuations in that swelling over time, but by a year, you mostly are back to normal. If you still have a lot of hardness and swelling in that area and you're more than a year post-op, then you should reach out to your surgeon. If I'm your surgeon, please let us know. Send us a message from Clara, give us a call to evaluate your case.
Okay, I think the part of the ultrasound and the injection versus the liposuction it wasn't clear for somebody, so she asked.
Okay.
So how do you prevent PE, pulmonary embolism, from lipo if you're injecting into the vessels without the ultrasound?
So the lipo portion is removing fat. The lipo portion is not injecting. And that's why in a BBL you do liposuction, which is removal of fat, and then you inject it in the buttock and hip area. When I'm injecting fat, I am 100% using the ultrasound. When I'm excising or removing, suctioning the fat, it's not needed because the risk of embolism is when you're injecting it, not when you're removing it.
Now it's clear also for me. I'm just kidding. Dr. V, I'm coming to see you soon.
Awesome.
The Faja Ferry.
Aww, I love it.
Okay. 12 years ago, I got implants.
Okay.
So it's time to an implant exchange, or I should wait?
It's up to you, and it depends on the implant you have placed, right? So if you have, for example, textured implants, you should have them exchanged. If you have just silicone or saline implants and the implant is not broken, you don't have any issues, no pain, you're happy with your implant volume, shape of the breast, you don't need to change them. But if they're textured, yes, you have to exchange them. So it all depends on the type of implant and you're happy with your results and if you have any issues with them.
Okay. How long is the tummy tuck recovery?
So recovery is, we can divide it in several stages, right? The first week is the one that you're going to need more help, you're going to be more sore, more slow, and you're going to be restricted more in the day-to-day stuff. Majority of patients are back to work at 2 to 3 weeks. At that time, the pain should be controlled. You may still get more tired than regular, but most patients are doing the day-to-day stuff with some restrictions, which are not lifting anything heavier than 10 pounds and no submerging water, beach, pool, jacuzzi. So if you're planning on a vacation or you work with lifting heavy stuff, then you need to wait for 6 weeks. So it all depends on what the recovery is, but those are usually the timelines that we discuss.
Okay, and I think this is the last question for timing.
Okay.
And it's about the massage for the tummy tuck.
Okay, so the massages on the tummy tuck are focused on the areas of liposuction for the first 2 weeks. We don't want to be applying pressure on the area where the muscle was repaired and over the incisions. So the center and lower abdomen should not be massaged for the first 2 weeks. But around that area, like the lateral abdomen, the waist, the back, all of that can be massaged. And actually, it's very helpful to get all that fluid out. At 2 weeks post-op is when they can start massaging the entire belly to get all that swelling out. Okay? Thank you so much, you guys. I hope this helped kind of understand the difference between what's ultrasound for imaging and what's vaser and ultrasound energy for skin tightening, and also the difference of why we use ultrasound with with BBLs just in the transferring portion of it and not in the liposuction portion of it. And also that if some people didn't know that I'm doing implant monitoring, it's out there. And if you're interested, give us a call. If you have any more questions regarding this or anything, of course, DM me, and I'll see you guys next Tuesday on Tuesday Tips. Take care.
Thank you. Thank you. Thank you.